All right, so today will be chapter 10, and we're covering the musculoskeletal system. So we're talking about the skeletal system and also the muscle system. And one of the things we'll talk about is the big thing here is going to be muscle relaxants, in addition to part of the muscular system, or excuse me, skeletal system that we go over. Just a little background information. Thoracic bones, the intro stuff. Let me jump right to the good stuff. What is the purpose of the what? Okay, so what is the purpose of the skeletal system? What's its job? What's its function? Lots of different things. You think of it as just bones, but it has a lot of job responsibilities. Support, if it wasn't for the skeletal system, we would all just be sort of this blob. So that's probably what we typically think of that it does. The other ones we probably don't actually think about, but it does these jobs well. Protection of organs. So, for example, we have the sternum, which protects the heart, the lungs. The skull protects the brain, etc. So, again, that's something you probably don't think about, but it is there for protection. It also helps with movement, so just walking around, picking things up, just general day-to-day stuff. Manufacturing of blood cells. So we may think of the bone marrow helping with red blood cell production, but or we may not, but anyway, it does. And then storage of minerals. So it has a lot of jobs and responsibilities that we typically do not think of. Again, the first one being support, we all think of that. But the other ones are there, and we may or may not think about those, but they're very, very important as well. And all this is to help maintain homeostasis. So if something happens, something gets off, then we got problems. With the muscular system, we'll be talking about three different things, or three different types of muscles. We're talking about skeletal muscles, so this is going to be help with movement. We'll talk about smooth muscles. And then the cardiac muscle, which is just going to be the heart. Okay. So talking about the skeletal muscles and movement. With voluntary movement, so if we actually want to move, so not that we touch, well, this works as well, involuntary movement. If we touch the stove eye or touch something hot, we automatically move without even thinking about it. But voluntary movement, wanting to pick something up, wanting to move, and also involuntary movement, so I've already mentioned that as well. And other things happen that we don't even think about, such as the digestion. We don't tell the food, hey, you need to digest now. It just does it. And then the cardiac muscle. So this is just the heart. And again, the heart is involuntary. So we don't tell it to beat. It just knows when to beat. And cardiac muscle is only found in the heart. I discussed the subtypes of disorders. So we're talking about sort of two systems together here. But the musculoskeletal system, there is several disorders that can occur. We'll discuss some of those, and they can happen at all ages of life. And usually we're having some type of pain, disability. Patient may have problems moving, because again, that's what we're affecting. One of the big is going to be trauma and injury. And this is probably what we typically think of. Some type of accident, could be some type of blunt trauma, maybe an accident of some sort. Well, I mean, more likely it would be an accident, but and then the fracture. So, so someone broke a bone, fractured bone, etc. And very common in children, but this could happen at any age. Also, your geriatric patients are going to be very susceptible to this as well. And some of the medications that we put the geriatric patients on may cause that orthostatic hypotension, which is what? Low blood pressure. So making them more apt to falls. And some of the medication we may put our geriatric patients on may cause drowsiness. So again, more likely to cause falls in our geriatric patients. So they're very susceptible to falls. And if a 65 or 75-year-old patient falls, they're much more likely to have an accident versus if a 20, 30, or 40-year-old patient were to have the same fall. But with pediatric patients, again, injuries that we typically would think of, falls, sports injuries, etc., they're going to be very susceptible to that. And I've already talked about our geriatric patients here. Soft tissue injury, something we typically may or may not think about. This is going to be to injuries, but we're not affecting the bones. We're not breaking a bone or anything here. With our contusion, this is going to be that some type of injury has happened, but we did not actually cut the skin or break the skin. With the hematoma here, we're talking about like bruising, for example. So blood has leaked out into the area, and bruising has occurred. And then a laceration. This is an actual cut. So we have active bleeding. All right. These are good definitions. Sprains and strains, very common. And probably one of a very common injury as well with our musculoskeletal or skeletal system specifically. The strain is going to involve ligaments. And this is a stretching or a severe case, a partial tear or perhaps even a tear, depending on the severity of it, of the muscle. And this is going to typically result in a stretching of the muscle when that muscle is already in its active state. Rheumatoid arthritis. This is an autoimmune disease. I mean, the body is attacking itself for some reason. It is abbreviated as RA. So you may abbreviate it, but make sure you know what RA stands for in case I ask you. It is an inflammatory disease that attacks the joints, and specifically the synovial joint or the synovial membranes. So between the bones, or like when a bone to bone come together in that joint, that is called a synovial joint. And you have cartilage. Actually, is there a picture in the book? Probably not. No. I'll try to find a picture on the internet in a few moments. But within that joint, you have the cartilage between the bones. You have a synovial fluid to help cushion that. And with rheumatoid arthritis, the inflammation is occurring here, and it's autoimmune. It can be painful, etc. Women are more likely, it says 2 to 3 times more likely to be affected versus men. You don't have to know the specific number, just know that women are more susceptible to it than men. And the actual cause is not known. We don't know what causes this to happen. It just does. And again, it affects these joints, and these are some examples of synovial joints as well. Gout, good old gout. Gout is another one, and we'll talk about acute attacks of gout as well as medication used for preventative of gout. This can occur in several joints, and what happens is there's crystalline deposits that deposit on that particular joint. And we'll talk in a moment what those crystal deposits are. Yep, very good. Someone's been studying. Or they could just look at the next slide. Either way. So it's an increase in uric acid levels. And it can start out with a single joint and usually the big toe, but not always can be the first one affected. But it's uric acid levels. So the medication that we're going to give is going to affect the uric acid levels. Make sure you know that. This is a good slide. Osteoarthritis. Is probably the most common type of arthritis among the geriatric population. And it can start earlier in life and slowly progress. And with treatment, we're going to be focusing on pain relief and improving function. And certain things the patient can do to help function. Physical therapy is a biggie here. We jump around a little bit. I'm not sure why the slides do this. But now we'll go back to our sprains and strains. Usually it's self-limiting, rest, physical therapy, ice, elevation will help with this. Now we're talking about the fun stuff, which is the drugs. Again, we like to throw drugs at problems. That's what we're going to do here. So when we give a neuromuscular block, they're going to interfere with the impulses of the motor nerves to the skeletal muscles. And by doing that, it's going to prevent that motor nerve impulse. So it's going to prevent that motor nerve impulse. So it's going to prevent that. It's going to prevent the nervous system from telling that muscle you need to contract. Bless you. Succinylcholine is probably the most common neuromuscular blocker. And it is given to relax during surgery and also to control breathing. Because one of the muscles that helps with breathing is the, starts with the D. Good job. Because during surgery, we're going to take over breathing for the patient. Adverse effects. Some of this sort of makes sense. The drowsiness, the loss of muscle strength, muscle weakness, all that. And all that makes sense. We would think about that as being adverse effects. But let's look at the last one here. So it can increase the potential if a patient has seizures. I'll keep that in mind too when we talk about nutrition next term. But you will see this slide on the quiz and final. Albuterol used to relieve pain because it blocks the formation of uric acid. Because that's what we're trying to control. We're trying to control sort of two things here, the uric acid and the inflammation that's occurring. Indomethacin is another drug that you'll typically see prescribed along with colchicine or albuterol. And the indomethacin is just an NSAID, a non-steroidal anti-inflammatory. Indications, which is what we, of albuterol, which is just what we talked about, gout, uric acid buildup, uric acid stone formation, so anything dealing with uric acid, albuterol, because it blocks that formation of that.